name is Zoe. I'm going to be your nurse today, and you have an order for a indwelling urinary Foley catheter. So first I'm going to wash my hands, get some clean gloves. Alright. Can you tell me your full name and date of birth, please? Good. Everything matches your wristband. Thank you, Miss Smith. It's nice to meet you. So first I'm going to put you in a good working position. So with this procedure, we are going to first be cleaning your perineal area, and then we're going to be inserting a catheter. And what that is, it's a tube that goes through your urethra and into your bladder. And you need this because your bladder has been distended for an amount of time, and we need to void the urine that you can't void on your own. So now I'm going to pull over my station and pull this back. Alright, and we're going to go ahead and put you in dorsal recumbent position since you are a female. Good, alright, now I'm going to pull this back, and the door is closed for your privacy. Alright, now we're using mild soapy water to clean your perineal area. Alright, so now we're going to clean down one side of your labia, down the other, and down your meatus. This ensures that we have no bacteria to allow for infection. So now we're just going to make sure everything is dry, going from the top to bottom. Good. Alright, so now we are going to begin the procedure. If you will, let me know if you have any allergies to betadine, iodine, or latex. Good. And we need to know this because we use betadine as a cleaning solution. Okay. Perform hand hygiene again before starting. Okay. And we're going to use this as a trash bag. Pull this away, back, only touching the 1-inch border, shiny side on the bottom, and now we're going to be putting on sterile gloves. If you have any questions for me, Miss Smith, you can stop me at any point and I can answer them for you. So now we're going to take our non-dominant hand to put on our dominant hand gloves. Alright, so still maintaining our sterile field. There we go. Okay, so first I'm going to separate the cotton swabs and squeeze out the lubricant. Okay, and now I'm gonna pour out the betadine solution onto the swabs. And now I'm gonna use my clean, sterile catheter and go ahead and lubricate it 2 inches. I'm going to attach the balloon liquid syringe. Okay. Alright, Miss Smith, we're getting ready to clean your perineal area with the betadine solution. So now you're gonna feel me touching down here with my non-dominant hand, and we are going to be cleaning with the dominant hand. So first we cleaned one labia. Now we're cleaning the other, making sure not to break the sterile field going around it, and then down the meatus. Alright. Okay, Miss Smith, we're ready to begin. So now I'm going to spread the labia, take the urinary catheter that has already been lubricated, and placing it in gently, not forcefully, 2 to 3 inches. Okay, I'm seeing some urine, so now I'm going to push in just 2 more inches. Okay, so now I'm going to maintain the position of the catheter and fill the balloon. You should not feel any pain in this procedure, Miss Smith, so let me know if you do. In a normal situation, the balloon would fill all the way. But for simulation purposes, we're just going to stop there. And once the balloon is filled, you would pull back slightly for resistance. And it is secure. So now we take out the syringe. And I would not go over the sterile field, I would go around it. So now we're going to make sure there's some leeway. And attach this to her thigh. Because she is a female, we are going to put it to the thigh. And we are going to place the catheter bag below urine level under the bed rails. Okay. Now I'm going to get you cleaned up. And we will take a fresh rag and wipe off the excess betadine. And make sure that she is also dry. Okay, so now we're just going to clean everything up. We will throw everything away. Put the patient back in a comfortable position. Do you have any questions for me, Miss Smith? Okay, is everything comfortable at the moment? Good. Okay, now I'm going to put you back in a comfortable position. You do have your call light, so if you need us, let us know. Alright, and I'll be back shortly for a urine sample. Hey, it's Zoe again, and I am back for a urine sample. And since we didn't take it out right away, we're going to be taking it out of the port because it is the most sterile. If you will, can you tell me your full name and date of birth again? Good, everything matches again, Miss Smith. Thank you. Okay, first I'm going to bring you up to a good working position. Has everything been comfortable for you so far? Good, okay. I'm going to pull this back just for a second. Yeah. would get a clean, sterile syringe. But at the moment, we're just going to reuse this one. And a clean, sterile, or a cleaning pad to clean the port. Okay, so now we're going to clean the catheter port. And with our sterile syringe, we're going to be removing some urine. Good. Okay, so then we put it in our collection cup. Pretend it goes in. And we would label it with the patient's name, room, and info and send it to lab. Okay, Ms. Smith, we'll see you once you get your catheter out. Again, you know where your call bell is. Okay, Ms. Smith, it's been a good 3 days and your urine is coming out nicely. So we're going to give your bladder a break and take out the catheter. And we do have an order for it, so if you will, tell me your full name and date of birth. I know you've done it a lot, but we just got to make sure. Good, everything matches with the order. Has everything been okay for you so far? Good, I know you're glad to get it out finally. Okay, so again, we're going to raise you to a comfortable position. Okay, I'm just going to pull you back here. Alright. And now we're going to get a clean, dry towel to place underneath you so you don't have any leakage on your clean sheets. You will spread your legs for me just a little bit. Thank you. Okay, so now I'm going to empty out your bladder bag. And we would have a collection cup for this, of course. Okay, so that's good. And again, we still don't want it above the bladder because we still haven't taken it out yet. Take it off the leg. And we're going to deflate the balloon. And this is important because if we don't deflate the balloon, you would feel some pain. Okay, in a normal situation, my syringe would not be messed up. Okay. In a normal situation, the balloon would be deflated. But right now, we're just gonna have to work with it. Okay, Miss Smith, we're ready to take it out. If you will, just breathe in deep. I'm going to count on 3, okay? 1, 2, 3. And I would slowly want to remove the catheter. Good. We will throw this away. And of course, clean the patient. Alright. It was nice working with you, Miss Smith. Get rid of this. Make sure the patient is comfortable and get you a new gown because it did soil your gown just a little bit. Okay. I'm going to put you back in a comfortable position. Let us know if you need any help with anything. And we hope you get better soon. Thank you, Miss Smith. So now I will document how the patient reacted to the catheter, and we're good.